Hey everybody, my name is Camille. Welcome to my channel. I wanted to come on here and make a video about how to even begin to construct a personal statement. It's probably the pinnacle of your application. At the end of the day, when you submit your application, it's just the paper version of you, and in order to actually put your personality within the application, the personal statement is a perfect place to kind of insert that and make sure you are seen in that type of way. So I wanted to make this video to talk about a few topics that I think you should consider before even writing the personal statement, if not after you've written your personal statement, to go back and make sure that you've hit these points, because I think following this will help you have the best personal statement or the most effective personal statement. So I have my handy dandy notebook as usual, and I'm going to read what I have here. So my first question is, why medicine? Why do you want to be a doctor? Why do you not want to be a nurse or something else in the medical field? You want to make sure that your why is important, not only to explain and reflect upon within your personal statement, but also this is going to be your why when you are down and out during medical school. You don't even know why you signed up for this crazy time commitment and insane amount of information to memorize and then regurgitate and then be able to apply in different clinical settings. Maybe not even clinical settings, but different settings in general. You want to make sure that your why is apparent, if not anything else, within your personal statement. Next, you want to briefly address your red flags that you see within your medical school personal statement. If you've had a low GPA, if you have a low MCAT score, if you maybe don't have as many extracurricular activities, whether it's due to the pandemic, whether it's due to an illness, a car accident, what have you, you want to make sure that you address that within your personal statement if possible. I wouldn't hone in on it because there's also other places within your application that you can include, whether you're a disadvantaged student or you have academic probationary notes or memos on your transcript, your academic transcript. You're going to want to make sure you note that here. If not, there's other places in your application to put it. Lastly, I want to make sure you guys answer how you would use medicine within your personal statement. This is kind of tricky because, if anything, I probably would word this as how you see yourself being able to use medicine based on your past experiences, whether it's helping an underserved community, whether it's actually practicing in a rural area. There's all these different things where the way you envision yourself practicing medicine in the future can be put into your personal statement, and this will help you. And I said before that this is a little bit tricky because you don't want to just talk about medicine, because medicine is a noun, it's not a person. So I see a lot of students who write, oh, well, medicine really taught me this. Was it medicine, or was it a physician you used to go to when you were a child, or was it that emergency visit you had been exposed to, when you broke your arm? That's the type of things that you need to include in your personal statement to then reflect upon and get to the nitty-gritty of how you feel like you could use medicine as a resource to actually then apply it to help somebody's life. So one of the core competencies also is system-based practices. You want to understand the whole system of what you're doing. You want to, if anything, provide the most optimal healthcare for your patients. If you were able to see how the greater healthcare system, whether it was insurance, whether it was you within a hospital setting or a clinical setting, can see how all these different little pieces within a system of healthcare itself were able to provide the most optimized healthcare, or even not the most optimized healthcare, to show inequities in health access or healthcare quality, you want to include this within your personal statement. If anything, you also could include this while talking about how you envision yourself practicing medicine, because this might be a nice parallel into that question. So I hope this video has helped you kind of consider the types of things that you should include within your personal statement, whether it's what you think you can bring to the school or you think you can bring to even the medical profession. I hope that you guys take this stuff into consideration and make sure that you show your personality and your reflection within your personal statement. It honestly could read like a story, but if anything, make sure it is 100% you.